Good evening. This week we're discussing phantom limb pain, which was very interesting for me. I had no prior knowledge of this. So basically, phantom limb pain, 98% of amputees experience phantom limb pain, which is the signaling sent through neurons to the brain that a limb is still present, even if that limb has been removed, either medically or you were born without it, or so on and so forth. And basically, people will experience like your arm or leg falling asleep. They'll experience that even if that's not there. They'll experience the flexing of the limb, and they'll also go as far as having ingrown nails or the feeling of ingrown nails and ingrown toenails. And it's managed through currently managed through medications, prosthetics, and the mirror therapy. And I'm a huge fan of House. If you like House, you check out season 6, episode 4. It shows Dr. House dealing with a patient that has phantom limb pain, and how he helps them correct it. So basically, in my mind, as a human, you're born with a map in your brain of what your body's supposed to look like. When you lose that limb, that portion of the brain is no longer in use, and the brain is going to adapt and reset, if you will, and start using that portion. And that would explain why in some medical experiments that the touching of a portion of the face may signal what they think in their mind is a portion of the wrist or arm or leg or foot that's no longer with us. I think science will help in the future in mapping these out, and we'll be able to know before or after they lose a limb exactly where we can make a difference, and hopefully not have to use medications to cover it up.